all of us can play a part in our communities. All of us have something to offer, be it time, expertise, or the extra attention to care for each other. It takes all of us to build an inclusive society. Let me first touch on how we'll increase support for persons with disabilities and persons with mental health conditions. The enabling master plans are 5-year national plans to support persons with disabilities and their caregivers. Under the 2 previous master plans, we increased support in areas such as early interventions and education, employment, care services, assistive technologies, and accessibility. We'll launch the 3rd enabling master plan, which was put together by a committee of private and public sector representatives. The master plan calls for the government and the community to better integrate persons with disabilities into the workforce and give more support to their caregivers. Today, higher functioning graduates from the special education schools who can work are matched with special training programs to prepare them for employment. We'll make these training programs available to not only graduates with mild intellectual disability and autism, but also those with moderate intellectual and multiple disabilities. To support caregivers, we'll set up a Disability Caregiver Support Center to provide information, planned respite, training, and peer support groups. The center will also work with VWOs to pilot programs catering to caregivers of newly diagnosed persons with disabilities. Including existing initiatives, we expect to spend around $400 million per year on initiatives supporting persons with disabilities. The Minister for Social and Family Development will elaborate at the COS. We must also rally around those with mental health conditions, including dementia. Mental health issues may not be easy to talk about, but we can make good progress when the community comes together. Since 2012, MOH has partnered VWOs to set up 36 teams that provide outreach and allied health support in the community. Last year, MOH also launched dementia-friendly communities in Hong Kong North, McPherson, and Yishun. These communities are networks of residents, businesses, and services trained to look out for and help those with symptoms of dementia. We'll resource VWOs to set up more community-based teams to support those in need, as well as educate the public on mental health issues. MOH will provide mental health care services in polyclinics as part of the broader effort to improve the delivery of care within the community. It will also involve the wider community and expand the number of dementia-friendly communities. The National Council for Social Services will also lead efforts to integrate persons with mental health issues at the workplace and in wider society.